So item number 4, AB 1739, Ms. Waldron. Thank you.
Thank you, Mr. Chair and committee. I'm here to present AB 1739, Medi-Cal allergy testing, and I would like to note that I will be taking the committee amendments listed in the analysis and also authors' amendments to delete the declarations and findings in the bill. And I look forward to working with the California Medical Association on addressing any other concerns. Just briefly, allergies were diagnosed by an allergy specialist who used a skin prick test to infect the skin of a patient and waited to see what the patient reacted to. And this requires the patient to be referred to an allergist by the primary care doctor and requires the patient to undergo a series pricks to their skin. But now blood tests are equally effective in diagnosing allergies and can be ordered directly by a primary care physician without referring to the patient to a specialist. Medi-Cal, however, does not cover this. Medi-Cal's provider manual explicitly favors skin testing over blood testing by requiring a primary doctor to identify a contraindication to skin testing before ordering a blood test. And this is contrary to national guidelines. And I will be brief, so I urge your support.
Thank you. Testimony?
Dr. Wood, members, good afternoon. My name is Dr. Inderpal Rendau. I'm Associate Professor of Pediatrics at University of California, Irvine. I'm a researcher and clinician in pediatric pulmonology, adult pulmonology, allergy, and immunology. I run the largest food allergy center in the country at Miller Children's Hospital, and we run the 6th largest pulmonary and allergy center in the country at Miller Children's Hospital. I presented in front of this committee on August 12th, 2014 regarding this same issue. In that year and a half of time, allergic disease, of which I think I'm qualified to speak about, has had the same diagnostic testing available in this blood-based test, which has been mentioned, which is of equal efficacy to skin testing. And in that time, the incidence of allergic-based diseases, which include food allergies and asthma and many other skin conditions, has actually increased. So this issue continues to grow. It has not gone away. It is not getting better. And in this process, our primary care doctors who need access to the ability to test our Medi-Cal patients have still suffered the same limitations. A year and a half ago, it was requested that these tests essentially emulate what is seen in the private sector, which is primary care doctors can order whatever allergy testing by blood is needed for these patients. In that time, we have had these same issue where essentially the private primary care doctors are having limitations, either having to check boxes or find contraindications to skin testing, which is not seen in any other healthcare setting in this country and, in fact, in many other socialized healthcare systems. In that process, these patients continue to get sick. They continue to utilize hospitalizations, emergency rooms, et cetera. And in that process, these patients are simply not getting better. So in 1.5 years' time, I have seen this issue not move, and it concerns me because, again, these patients deserve better. And I request you to look at the concept of precision medicine, which is often brought up. It was brought up in the last State of the Union. And what that concept says is this. Instead of treating all patients the same, we should use the best standards we have appropriately and break down these patients with targeted based therapy. Blood-based allergy testing does that. It's been around for a very long time. It's very valid. It's as good as skin testing. That will help these patients, and I think our Medi-Cal patients certainly deserve that. Thank you.
Thank you.
Mike Robeson here on behalf of Thermo Fisher Scientific, and I really can't add anything more to what Dr. Rendau has just said, and ask for your aye vote.
Thank you. Others in support, just your name and organization, please.
Mr. Chair, Eduardo Martinez with the California Medical Association. We're actually sort of in a tweener category. We've had some really good discussions with the author's office and the sponsors. They've been very accommodating so far. We think we're going to be able to be moving to a support position very soon. And thank you for all the good work on this.
Thank you. So others in support? Other tweeners? Anyone in opposition? Make sure nobody wants to run. Okay. Okay, seeing no one in opposition, bring it back to the committee. Questions, comments from the committee? Seeing none, I'll give you the opportunity to close, Ms. Waldron.
Thank you, Mr. Chair. I urge the committee for an aye vote.
I want to thank you for bringing this bill forward. As someone who's had allergies all my life and gone through multiple skin testing programs, I guess what you call them, tortures is what it felt like. So I appreciate the spirit in which this is coming forward, and provide another opportunity for people to have a test that will hopefully provide exactly the same information with one draw of the needle instead of 64 or 65 or whatever. Wow. So I appreciate that. We have a motion and a second. The motion is due pass to appropriations. And Madam Secretary, please call the roll. As amended. Sorry, as amended, yeah.
Wood?
Aye.
Wood, aye. Mainshine? Bonilla? Burke? Campos? Aye. Campos, aye. Chu? Dababne? Gomez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Olson? Patterson? Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Thurmond? Waldron?
Aye.
Waldron, aye.
So we have 5-0. We need 5 more votes and 10 more members. So thank you very much, Ms. Waldron. We'll leave the roll open. Mr. Ridley Thomas, would you like to chair for a moment while I present a couple of bills? Thank you. There he is. Okay.
You want to proceed, Mr. Chairman?
Thank you, Mr. Chair and Vice Chair and members. I'm presenting AB 2115. AB 2115 requires health plans and insurers to include a notification of the availability of pharmaceutical companies' drug assistance programs to those who are losing their current coverage. This notification would be in addition to information provided about potential coverage under Covered California or Medi-Cal. While California has made great strides in expanding coverage, there are still gaps in coverage, and people still fear out-of-pocket costs that may occur for medical care and prescription drugs when coverage is lost.
We have a motion to do pass as amended in a second. You accept the amendments?
I accept the amendments, and as we continue to explore how to address rising costs of drugs and the impact those costs have on patient adherence to prescription drug treatment plans, I believe drug assistance plans can help play a role for people in between coverage or dealing with unique medical conditions. The availability of free or reduced cost programs is not widely known by the public, and I believe AB 2115 proposes a reasonable way of increasing awareness of these valuable drug assistance programs. The programs are not a comprehensive solution nor the answer to a long-term problem, but they address the concerns over growing costs and are a valuable tool for those people who may not fit neatly into existing coverage options. I've agreed to take the amendments and to address the concerns that in disclosing information required by the bill, we are providing accurate information and ensuring people know these programs are not insurance coverage, so they are not misunderstandings about individual requirements under the ACA. Here in support is a representative from the California Life Sciences Association, and I respectfully ask for your aye vote.
Thank you. Witnesses in support?
Greg Herner on behalf of the 750 members of the California Life Sciences Association. I think the author explained it very well. We're simply trying to take care of potentially those 3.8 million Californians that are not receiving coverage right now, help them with prescription adherence for their medications, keep them out of our emergency rooms. The state of Washington implemented a program similar to this recently, and in 2015, they served over 1,100 patients with over $6 million in assistance. They've handed out over 41 million prescriptions since 2009. Obviously, we think we're going to do much better than that by providing this information and reaching out to all of those Californians that may need assistance, and we would urge your aye vote.
Thank you. Additional witnesses in support?
Jerry Jeffy, representing the California Chronic Care Coalition, in support of the bill.
Thank you. Any additional witnesses in support?
Well, actually, Mr. Chair, members, Nick Luizos with the California Association of Health Plans. With your indulgence, we will review the current version of the bill with the added amendments and get back to the chair's office with some of our feedback. We just want to reserve our right to take a position in appropriations.
All right, thank you. Additional witnesses?
Beth Capel on behalf of Health Access. We'd like to thank the author and the sponsors for working with us, and we'd like to continue to work to make sure that the proposed amendments apply to all sections of the bill, not just the first section.
You don't know
which is what we had understood to be where we were going, but it's been a busy week, so we understand. We will work with the staff on that, finalizing that. We would note that, as the author noted, patient assistance programs are not health insurance, and that all of us are now required to have health insurance or pay an income tax penalty. So it's important that folks know that this is not a substitute for comprehensive coverage, nor do we think the chair thinks it is. So thank you.
Thank you.
Thank you. Additional witnesses? Questions of the committee? Thank you. You gave yourself a due pass recommendation.
I did.
That was wise to be of one mind as amended to appropriations. With that, I think, what have you closed?
Just respectfully ask for your vote, Mr. Chair.
Thank you, Mr. Chairman. Call the roll, please.
Wood?
Aye.
Wood, aye. Mainshine. Bonilla. Burke. Campos. Chu. DeBobne. Gomez. Hernandez. Lackey. Aye. Lackey, aye. Nazarian. Olson. Patterson. Ridley Thomas.
Aye.
Ridley Thomas, aye. Rodriguez. Santiago. Steinor. Thurmond. Waldron. Waldron, aye. DeBobne.
Aye.
DeBobne, aye.
That is on call. It has 5 ayes, no votes. Alrighty. The next bill is was it 2260 by file item 13. We're ready when you are.
Thank you very much. As many of you know, I represent the North Coast, which encompasses the northern half of Sonoma County all the way to the Oregon border. The 2nd Assembly District alone covers 1/3 of the California coastline. When there are life-threatening emergencies, it can often happen in remote areas of my district, places where a regular ambulance will have difficulties quickly getting to a patient. Last Christmas Eve, a person in Trinity County was stranded on a highway for 10.5 hours before help arrived.
I see a motion by DeBobne, a second by Campos.
Due to the geographic remoteness of my district, air ambulances play a critical role in emergency situations. When saving a life is on the line, every single second and minute count and can be the difference. Air ambulance providers should have only to focus on getting to a patient as quickly as possible and not on unnecessary administrative burdens. AB 2260 requires that the Emergency Medical Services Agency coordinates and makes consistent the data that air ambulance providers submit to local emergency medical service agencies. The bill will ensure a single data submission standard and eliminate the duplication among the LEMSAs. We understand the local EMS agencies have concerns with the bill, but we've come to a resolution, and we'll work with them on the technical amendment should we go to Assembly Appropriations. Here in support are Kat Scott on behalf of the California Association of Air Medical Services and Lynn Malmstrom, CEO of CalSTAR.
Thank you. Witnesses in support, 2 witnesses up to 3 minutes each.
Good afternoon. We'll hope not to take that much time. Catherine Scott, representing CAMS. Again, I think the author adequately addressed the bill. It will provide a single format for this data submission for our ambulance providers who cover multiple jurisdictions and can cover as many as 3 jurisdictions in one circumstance or one flight. So it's important that they can make consistent this data and allows them the efficiency to then use that data on a statewide basis for review and analysis by the local and state EMS agencies. We ask for your support.
I'm Lynn Malmstrom, President and CEO of California Shock Trauma Air Rescue, also known as CalSTAR. We're very excited about this bill as it will improve and simplify our data reporting across the state. Historically, the data reporting has not been standardized and has required almost a full FTE, full-time equivalent, to comply with various LEMSA databases. While the bill is not perfect and does not solve all of the state data issues, it does represent a giant leap in the right direction. I'd like to thank Dr. Wood for your support of the EMS industry and for your work on this bill, and I would also like to thank the committee and ask for their aye vote.
Thank you.
Thank you. Further witnesses in support, name and organization only, please.
Aaron Cox, PHIR Medical, from Reading. Please support AB 2260.
Good afternoon. I'm Nancy Herbert, flight nurse out of Sonora, California with PHIR Medical, and I support AB 2260.
Sheila Shafi, PHI, Modesto, flight nurse. I would like AB 2260 to pass, please.
Trey Bain, flight nurse from Susanville, California. I support AB 2260.
Good afternoon. Timothy Christian, Redding, California, PHIR Medical, and support 2260.
Hi, good afternoon. My name is Lori Hines. I'm the clinical nurse educator for CalStar Air Ambulance here in McClellan, and I support AB 2260. Thank you.
Chris Hunt, Training, Compliance, and Operational Control Center Manager for CalStar out of McClellan. I support AB 2260.
I'm John Betancourt. I'm a Regional Operations Director for CalStar based out of Concord, Oakland, and Ukiah. I support AB 2260.
And Michael Legal, Regional Operations Director as well for CalStar, South Lake Tahoe area, McClellan, as well as Auburn. And I'm in absolute support of AB 2260.
Thank you. Any further witnesses in support?
Mr. Chair and members, Betsy Armstrong on behalf of the EMS administrators. I'd like to thank the author and the sponsors for working with us to address our concerns. Thank you.
Thanks. Any other witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Questions or comments from the committee? Mr. Ridley Thomas.
I just wanted to applaud the chair for bringing the bill forward. I became familiar with this issue last year. One of our colleagues from Santa Clara County brought a bill forward and wasn't here to present. So I subbed for him.
Thank you.
Involuntarily, I guess. But clearly you have command of the issues, and I want to thank the personnel who provide these essential services. We never know which one of us may end up needing their services, so anything we can do to protect and enhance this system is intentional, serious, and improves quality of care. So it's a salute to you on something that's real, that's going to improve health care. Thank you.
Thank you.
Thank you. Any other questions or comments from the committee? Seeing none, Mr. Chair, you may close.
Just respectfully ask for your aye vote.
Okay, we have a motion and a second. The motion is due pass to appropriations. I'd ask clerk, please call the roll.
Wood.
Aye.
Wood, aye. Mainshine.
Aye.
Mainshine, aye. Bonilla. Burke. Campos. Campos, aye. Chu.
Aye.
Chu, aye. DeBobne. Gomez. Hernandez. Lackey.
Aye.
Lackey, aye. Nazarian. Olson. Patterson. Ridley Thomas.
Aye.
Ridley Thomas, aye. Rodriguez. Santiago. Steinnorth. Thurmond. Waldron. Waldron, aye.
Yeah. You have 7-0. You need 3 more votes. It'll remain on call.
Great. Thank you.
And Mr. Chu, while our chair is walking back, if you want to come up.
Mr. Chair, colleagues, I appreciate your consideration of AB 2725, which would address the food waste created by confusing date labels. I've handed out to you today a couple of handouts I'd like to talk through. So the problem that we're talking about is the daily confusion that we experience when we open our refrigerator. Handed out a sheet that's simply called to eat or not to eat. This is the dilemma that we all see when we open up our fridge or open up our cabinets of the 24 or so different labels on all of the foods that we have, and the fact that there is not a standardized date label on any of our food. Best by, display until, expires on, fresh before, sell by, use by. Are these standards for health and safety, for freshness? Do we toss food or do we keep it? There's incredible food waste. If you go to the second handout, who is this bad for? This is bad for consumers. We know that up to 25% of the food that consumers buy is never eaten. It's like walking out of a supermarket with 4 bags and dropping one in the parking lot. 20 pounds of food per person per month we're wasting. It's bad for business, for the entire food chain, from fork to table, from farmers to manufacturers, retailers to restaurants and food banks. Wasted food costs our economy $218 billion a year, according to a recent ReFed study. It's bad for the environment. We're talking about 5.5 million tons of wasted food in landfills every year, just in the state of California. 8 million tons of greenhouse gases, 20% of our state's methane emissions. And it's bad for hungry families. At this time, we have 6 million Californians who are food insecure. 1 out of 4 children in the state of California going hungry. This week alone, in LA County, a survey, 1 out of 3 residents in LA County live with the anxiety of going hungry. If we could save a mere fraction of our wasted food, we could end hunger in our state. Our bill is very simple to start to address this. It would streamline the 24 or so labels that you see on foods by creating 2 uniform standards for how our foods ought to be labeled. A freshness standard for quality, best if used by, and an expiration date for foods that have become unsafe, expired on, to indicate if there's a high level of risk associated with consuming a food past a particular date. Our bill also requires communications between manufacturers and others to use internal dates or barcodes if they're not meant to be dates for consumers. We came across these 2 standards not just because we thought of it from thin air, but because there are industry leaders like Walmart and Smuckers who thought this made sense. The industry understands this is important, and we've been wasting money, and this has not been good for business, and they have convened a working group to think about how to address this as well. Let me make this clear also. We're not talking in this bill about creating any new requirement to put any new date label. We're simply saying if you have a date label on a product, you should streamline what that date label is about. And it's important for us to educate consumers, to ensure proper food handling, to reduce food waste. If we could move this forward, it would be good for consumers, business, the environment, and hungry Californians. I also want to thank our colleague, Assemblymember DeBobney, for his co-authorship. I have a number of expert witnesses with me today who can testify and answer any technical questions. And with that, I'd like to turn it over to Mark Murray, the Executive Director, Dana, Ms. Gunders, the Senior Scientist of NRDC.
Good afternoon. Dana Gunders, Senior Scientist with NRDC. I'm also the author of a book called The Waste-Free Kitchen Handbook, a report that's widely recognized as sparking the national debate on food waste, and a co-author of a report called The Dating Game that brought to light this issue of confusion around date labels. Consumers are responsible for the largest chunk of all of the food going to waste, representing about 40% of all the food going to waste today. And confusion around date labels is a key factor in this. The problem is this: the vast majority of dates on food are not about safety. They're not even about food spoilage. They are simply the manufacturer's best guess of when the food is at its peak quality or freshest. However, consumers don't understand that. They are treating these dates like they are a bright red "don't walk" sign instead of the blinking white guy on the crosswalk, which is what they really are. And this is costing them money. This problem affects people across all income levels. You can picture a mom who's struggling to feed her kids sitting there with a tub of yogurt that she spent good money on, but it's past its date, and she doesn't want to make her kids sick, right? And even if she's food insecure, that doesn't mean she wants to give them bad, quote, bad food, and so she throws that food away, and yet she didn't have to because that food was perfectly good, and she just misinterpreted that date. It also affects recipients of food donations because there's a stigma currently around past dated foods. Again, people thinking that they are bad. It also primarily affects perishable foods, which are the most healthy foods that we want to see people eating. And it affects rural residents who make less frequent trips to the store and therefore have typically buy in larger quantities and try to keep food for longer. So we need to educate consumers on this topic, but we can't do that right now. And we can't do that because there's no standard definition or any system that controls these dates around food. And that's what this bill would do. It would create that standardization. Now, some may say there's not enough research to go forward with this, but I invite you to walk into your local grocery store and do your own research in the milk section to see just how confusing the dates are. And if that doesn't work, there are several studies to support standardizing these date labels. While we don't know exactly how much food is going to waste directly from this confusion, we do know that from one grocery industry study, 9 out of 10 consumers report throwing food away prematurely because they misunderstood these date labels and are concerned about their safety. Another study showed 82% did not accurately interpret the phrase "use by." Some have also suggested that voluntary guidelines by the industry can solve this problem, but I would tell you that it's hard for the industry to control every single food product out there. So I urge you to support 2725. Thank you.
Mr. Chair, members, Mark Murray with the Environmental Group Californians Against Waste. Consumers want to know, can they continue to eat this can of tomatoes after the Best By date? Grocery stores want to know, do they need to pull this from the shelf after the Best By date? That's what this legislation is about. In the absence of voluntary industry action, in the absence of federal action, this legislation is trying to create some order in the chaos. The industry needs you to move this bill along so that they can get their shit together to come up with a solution. Right now...
Please.
Apologize. Right now, the industry is saying that they don't want to see a state-by-state solution. We don't want to see a state-by-state solution either. We want California to move forward so that the industry comes forward with the kind of voluntary solution that they proposed 13 years ago. The federal government convened the industry in a working group 13 years ago to come up with a uniform voluntary solution or a federal solution. The industry promised that they were working on something. 13 years, we're still waiting. So the industry needs you to move forward with this. Right now, sell by, use by, Best By, or simply mystery dates on packaging are not providing consumers with accurate or clear information of how they move forward. We need you to move this legislation forward so that the industry will come to the table and inform what do they need. California represents 12.5% of the marketplace in the country. If we move a solution in California, there won't be state-by-state solutions. Everyone will follow this California solution. Urge an aye vote.
Thank you. Others in support, name and organization, please.
Emily Rush with CalPIRG, California Public Interest Research Group, in support.
Michael Daff with the Prayer Ann McKaylee on behalf of Republic Services, in support.
Sylvia Solis Shaw on behalf of the Solid Waste Association of North America and on behalf of the Western Placer Waste Management Authority, in support.
Good afternoon, Danielle Lynch on behalf of the California Association of Local Conservation Corps, in support.
Good afternoon, Diana Vasquez, Sierra Club, California, in support of the bill.
Melissa Romero on behalf of the California League of Conservation Voters, in support.
Matt Milan with the California Compost Coalition, StopWaste.org, and the California Climate and Agricultural Network. Thanks.
Thank you. Witnesses in opposition, please come forward.